Hello there. How I restrain dogs. This is video 2 in a 4-video series that demonstrates and discusses how to restrain dogs for physical examination and other procedures. In this video, I shall be assisted by Chico, my 6-month-old Shih Tzu, whom I have recently achieved because he had matted here. Restraining the cooperative dog. But what are the characteristics of a cooperative dog? This is the calm temperament dog that excitedly welcomes you into the examination room with hugs, or just sits or stands next to the owner and loved by your presence. Cooperative dogs will allow you to perform procedures that cause minimal pain and or discomfort. Beware the cooperative dog will resist you are touching or palpating in a sore or painful part of its body. What are the tools for restraining a cooperative dog? You need voice commands to call Chico and tell her what you want. You need an assistant whom I call my 2 extra hugs, or you need a reach or a collar. Do you need a muzzle? Not necessary. Only necessary if you are going to touch or palpate a sore part of the body. What is the protocol for restraining the cooperative dog? For small dogs, I let the owner place the dog on the table, on the examination table, and then let my assistant hold the dog from behind the shoulders, right? Behind the shoulders. If I'm examining the back or taking the temperature, I want my assistant to hold right there. If I'm examining the head, I want my assistant to hold the dog from here, behind the shoulders, right? And I can examine the mouth, the ears, the eyes, all of those, right? The other thing is just a very quiet dog. My assistant can just hold on to the collar, just like that. Large dogs, normally I examine the dog while standing on the floor or on the table with my assistant holding the collar. Sample procedures you can perform on a cooperative dog. You can do a full physical examination. You can trim the nails. You can express the anal glands. You can administer subcutaneous, intramuscular, and intravenous injections. You can draw blood. You can aspirate the hematomas and cysts. You can do deep clean the ears. Alright, now let's go to the restraining the anxious and nervous dogs. What are the characteristics of the anxious and nervous dog? Anxious or nervous dogs have variable temperaments influenced by each environment they encounter. In the presence of their owners, they exhibit a calm and cooperative attitude. In the presence of strangers, they exhibit a defensive attitude to protect themselves and their owner. In the examination room, the anxious or nervous dog will huddle next or hide behind its owner. What are the tools for restraining an anxious and nervous dog? You need verbal commands. You need the 2 extra hugs or an assistant. You need the owner's assistant. You need a muzzle. You need a reach. You need a collar. You need a towel. You may need a sedative. What is the protocol for restraining an anxious dog? For small dogs, I offer the client a muzzle to place on the dog. Even if the client insists, the dog doesn't bite. Dogs bite because they are scared. It's not that they want to bite, but they want to protect themselves. Let the client or assistant place the dog on the table. The dog is already muzzled. If the dog stays calm, proceed with the examination. If the dog is frantically fighting to remove the muzzle, consider wrapping the dog with a towel to keep it calm. Alright? Most of the time when you wrap them with a towel, like that, they will stay quiet. Alright? He has a mother too. So if he stays quiet with the towel, you can go ahead with examination. If that does not help, consider sedating the dog with isoflurane with a gas mask. Large dogs. Offer the client a muzzle to press on the dog, even if the client insists the dog doesn't bite. Let the assistant use the leash and attempt to take control of the dog from the owner. If the dog complies with the assistant's commands, the dog is likely to cooperate during the physical examination. If the dog won't budge and move away from his owner's side as is not fighting to remove the muzzle, consider doing the examination next to the owner. If the dog is frantically fighting to remove the muzzle, consider sedating the dog with dexmedetomidine. That's the end of the video. If this video was helpful, subscribe, share it, comment, or ask a question below. And thank you for watching.